Okay, so a lot of these things, unfortunately, you're just going to have to memorize. But the good news is that I can help a little bit. Alright, so autoantibodies. And they don't just put this here in first aid because it's good for you to know. They put it here because you always have questions. For example, they'll describe someone who has myasthenia gravis. Eyelids getting heavy, things are better in the morning, worse as it gets long at night, respiratory problems, they've been in the ICU a few times, that kind of stuff, okay? And they'll say, well, what's the origin of these problems? And you'll say, antipostsynaptic acetylcholine receptor antibodies. That's why they have this here, because these are test answers. So myasthenia gravis, better in the morning, compared to Lambert-Eaton myasthenic syndrome, better in the evening. A woman with antiphospholipid syndrome who has anti-beta-2 glycoprotein antibodies has a whole bunch of miscarriages. This is a normal woman. She's not like smoking or anything. She's not like falling down the stairs and stuff. But I've actually seen a few of these cases. These women just constantly have miscarriages. Anyway, ANA, not very specific. Typically associated with SLE, but you and I both know that you have to do anti-double-stranded DNA to be a bit more specific. People who have lupus anticoagulant, people who have anti-double-stranded DNA, anti-Smith, antihistone, think lupus. Rash, family history, maybe they have kidney problems. There's a lot of things that comes with lupus. A lot of things that come with lupus. Antihistone, though, you always think drug-induced lupus. All right. Mixed connective tissue disease, rheumatoid factor. Okay. So rheumatoid factor isn't particularly specific for rheumatoid arthritis. However, this absolutely is. I always remember it as anti-CCCP, kind of like Soviet Union, but obviously that's not what this stands for. What is it? Anti-citrullonated something peptide centromere? I don't know. But whatever. Rheumatoid arthritis, metacarpophalangeal joint problems, proximal interphalangeal joint problems. You want to think about someone, it takes them half an hour in the morning, because they have tight fingers, and it just you gotta move it back and forth, and then for the rest of the day it's okay. Think about things like swan neck deformities. Okay. Anti-Ro, anti-La, Sjögren, dry mouth, dry eyes. Okay. How about this? Diffuse scleroderma. Well, you want to think about eventually someone having problems with swallowing. Of course, limited and diffuse crest versus diffuse scleroderma. Rheumatologists are kind of moving away from these specific terms, but in terms of test questions, thinking about it in terms of limited and diffuse is still very helpful. And again, anti-centromere, crest, C for C. Okay. And what is that? It's calcinosis, Raynaud's phenomenon, esophageal desmotility, whatever, some other stuff. Antisynthetase, also related to mixed connective tissue disease. People with dermatomyositis. Also check sometimes for mixed connective tissue disease. That's pretty big. Dermatomyositis, think of Gratton's papules. Primary biliary cholangitis, no longer called primary biliary cirrhosis. Think about intrahepatic problems. Anti-smooth muscle, autoimmune hepatitis. Sometimes these two can kind of present the same way. I had an interesting case, or I saw an interesting case of someone who came in with autoimmune hepatitis, never had a problem in his life before, comes in, all his liver function tests are through the roof. Happened once, never happened again. But the gentleman, unfortunately, does not have a fantastic liver because of that. So here we're going to talk about P-ANCA versus C-ANCA, granulomatosis with polyangiitis, or Wegener granulomatosis. Now I'm going to show you a way cool image, and that's going to help you remember Wegener's granulomatosis and its association with C-ANCA. You'll never forget it. Look at this. Wegener's granulomatosis, nasopharynx, kidneys, to the lungs. Makes a wedge, so you'll never forget it. And if you tilt your head, the wedge looks like a C. Again, nasopharynx, kidneys, lungs. Makes a cool wedge that looks like a C. Antihemidesmosomes, bullous pemphigoid doesn't pop. Desmoglein, desmosomes, pemphigus vulgaris does pop. Here we go, celiac disease. So some people who have celiac disease have a relative IgA deficiency. And so sometimes if you do IgA anti-endomysial or anti-TTG, which is IgA, you're not really going to find what you want to find because, well, they have an IgA deficiency, and so your test isn't going to be super hot because of that. So that's why you got to do IgG tests. And that's actually a question that's becoming more and more common, not just in step 2, also step 1. And yeah, anti-glutamic acid decarboxylase, not just anti-islet cells, antibodies. Of course, type 1 diabetes, everyone knows islet cells, but this is something that I've seen a lot in questions recently. Yeah, that's good.